QA is the outcome of 30 years of focused attention culminating in a physiologically based, basic science-driven neurological hierarchy for the ordered application of clinical procedures and techniques. And it hasn't changed since we started it in 2005. And it actually goes back farther than that because I was working on it for a long time. Except for when brain is the primary organ, we change the order around a little bit when the brain is the source of the symptoms. Dr. Schmidt, I said this one. Okay, it is the common clinical. I thought, Dr. McCord's coming up. Let's not give him credit. Let's give him credit for his good quote that he did. Dr. Schmidt said, is the common clinical approach in all healing professions to look at a patient's local complaints as the primary focus of the initial clinical assessment. The QA clinical protocol revises this focus by insightfully approaching the patient's presenting complaints as an integral part of the overall physiology. It assesses and treats physiology gone wrong in a systematically oriented, logical, efficient, and clinically rewarding manner. I do like quoting myself, actually. So what we see is most clinicians tend to look at the local problem first and expand out into the systemic issues. But what we do in QA docs look at the systemic issues first and then look at local. This is not any more true than when we look at the brain, because the brain does affect everything. When the organ is the brain that we're treating, we change things around a little bit. So the order in which, this is Dr. McCord's, this is one of my favorite quotes. The order in which you perform your techniques may be more important than the techniques themselves. And that's very true. And especially true when you're trying to reorganize the brain. And it's why shotgun approaches don't work as well. If you can be precise and identify exactly what person needs at each time, what you're doing, each time you're doing this, you're changing something chemically, but you're also changing something neurologically. So you change, like when we do the TMJ open and close, right, left, and do the session 1 work that we did. We do that work, we're finding which pathway needs to be fixed next. And there's a hierarchy to it because it probably got uncorrected in a certain order, and it may need to be corrected in the same order. If you walk into a maze like that, and you walk out like that, or like that, you can't. You have to go the same way you walked in. You have to this way, this way, this way, and this way. And that's what the QA protocol does. And this addition to the QA protocol that we're doing for the brain is the same way, especially when there are brain issues, because the pathways are so complex in the brain. I can't begin to tell you all the pathways that are involved with what I'm doing, but I can tell you the best way to work your way out of them by the procedures that we're teaching. So the order in which we do things is sometimes more important than the techniques. If you do the techniques in the wrong order, you may be facilitating a pathway that needs to be inhibited. You may be inhibiting a pathway that needs to be facilitated. You may even be facilitating a pathway that needs to be facilitated, but you may be doing it at the wrong time. If a pathway needs to be facilitated, and there's a pathway that needs to be inhibited first, and you don't inhibit that pathway first, you facilitate that second pathway, it may overstimulate something. Does that make sense? If you have to inhibit something first, so that you don't drive it to fatigue, and you don't do that, and then you do your stimulus, you can make the patient worse, because you've stimulated a pathway that needs to be stimulated, but you're stimulating it because something else needs to inhibit it first. So it's like whipping a tired horse. You need to sometimes pull the reins on the horse before you can get it to rest, before you can get it working full speed. Maybe that makes a little more sense. But you inhibit certain treatments, certain nutrients, and certain treatments will cause inhibition, and certain other ones will cause excitation. And basically, if you follow the protocol, it'll take you through that. For example, I'll show you an example in just a minute.